This segment is brought to you by Gilead.
An estimated 1.2 million Americans are living with HIV, and about 14% don't even know they have it. The virus continues to disproportionately impact Black and Hispanic communities, women, and people who acquire it through heterosexual contact. Joining us to talk about HIV prevention and health equity are Ian L. Haddock, founder of the Normal Anomaly Initiative, and his nurse practitioner, Dr. Kendra Clack, with Crowfoot MD Clinic and Research Center. Dr. Clack, many people may not realize there are medications that can help prevent HIV. Can you explain what PrEP is and why having more prevention choices matters?
So we're 4 decades into the HIV/AIDS epidemic, yet an average of over 100 people are newly diagnosed every day in the United States. Good news is we have tools that can help prevent HIV. PrEP, which stands for pre-exposure prophylaxis, is a prescription medicine people can take before they're exposed to HIV to help reduce their chances of getting it. Taken as prescribed, PrEP can be about 99% effective in preventing HIV through sex. Barriers like stigma, low awareness, and adherence all play a role in starting or staying on PrEP. That's why having more prevention options matters.
Ian, take us back to the conversation the two of you had when you were thinking about switching your prevention approach. What did that discussion even look like?
When I was younger, I was told that getting HIV was inevitable, less like a possibility and more like destiny. I took a PrEP pill every day, but over time, it became harder to remember while leading an organization and traveling. I wanted to understand what my options were, and I talked with my doctor about a long-acting injectable.
Dr. Clack, can you talk more about this long-acting injectable PrEP option?
Long-acting injectable PrEP may help address some of the biggest challenges we see with HIV prevention, such as the difficulty some people have taking a daily pill consistently. Yeztugo, known also as lenacapavir and developed by Gilead Sciences, who we're here on behalf of today and who is compensating us, is FDA approved as a long-acting injectable PrEP medication to help reduce the risk of sexually acquired HIV-1 in adults and adolescents who weigh at least 77 pounds. It is currently the first and only FDA-approved PrEP option that's one office visit every 6 months with 2 injections per visit after starter dosing. However, your healthcare provider may require additional office visits. You must be HIV negative to receive Yeztugo and get tested for HIV before each injection. If you think you're exposed to HIV or have flu-like symptoms, tell your healthcare provider right away. HIV testing may be needed. Yeztugo does not prevent other sexually transmitted infections. Practice safer sex and get Yeztugo as scheduled. Missing doses increases your chance of getting HIV. Tell your provider about your medical conditions, if you're pregnant or plan to be, and all the medicines and supplements you take, as Yeztugo may affect some medicines. The most common side effects are injection site reactions, headache, and nausea. Rare, serious injection site reactions can occur, so tell your provider about any side effects. Ultimately, providers and patients should discuss the benefits and risks to determine whether Yeztugo or another HIV prevention option works best for them. And people can visit Yeztugo.com to learn more and view the important facts, including important warnings.
Now that you have been on Yeztugo for some time, how has the decision to switch to Yeztugo played out for both of you?
Yeah, I feel like Yeztugo has fit well into my life. For me, needing to schedule only 2 Yeztugo office-administered doses per year has been a positive part of my HIV prevention experience.
And you know, Ian, from a provider perspective, when prevention aligns with someone's busy schedule like yourself, they may be more engaged to the care. 2 yearly visits also creates an opportunity to check in on other primary healthcare needs, including mental health, not just HIV prevention.
Ian, what would you want others to understand about this prevention option?
Stigma and barriers to care can make conversations about HIV prevention harder. PrEP is a decision between you and your healthcare provider. The more we talk openly and get informed, the better equipped we are to help protect ourselves from HIV.
Dr. Clack, who should consider talking to their healthcare provider about this new HIV prevention option, and where can they find out more?
You know, anyone who is sexually active should learn about HIV prevention options like Yeztugo and speak with a healthcare provider to determine whether it could be right for them. You can also visit www.yeztugo.com for more information.
Thank you both so much.